Did you know that rare bleeding disorders may not be as rare as you think? Did you know that von Willebrand's disease is estimated to be roughly 1% of the United States population, meaning that over 3 million people are estimated to have von Willebrand's disease? And it is not considered a rare disease unless it's under 300,000 diagnoses. My name is Jonathan James with Hope Charities, and I'm excited today to talk to you a little bit more about von Willebrand's disease, which is another genetic bleeding disorder that is one that is very difficult to manage at times, difficult to get diagnosed, and sometimes the treatment plans require a lot of tending to maintain healthy access to a healthy lifestyle. So, we want to talk about these issues a little bit more deeply, and it's interesting because the data shows that a very, very small portion of people living with von Willebrand's disease are actively being managed. The CDC estimates that less than 30,000 people are actually getting treatment on a regular basis for von Willebrand's disease, which means that you may have undiagnosed symptoms that need attention that you have not been able to get the right answers for. And what I want to do today, and actually coming up soon for an event that we're hosting, a live educational conference called Advancing von Willebrand's Management on Wednesday, July 16th. We're going to be talking more in depth about what this bleeding disorder looks like, what kind of treatment is available, and what questions that you need to pose your physicians to see about if you are in a situation where you need treatment or maybe potentially need to get diagnosed in the first place. And today I've invited someone to join me to tell me a little bit about their story, Steph Reitberger. It is great to see you today. Thanks so much for joining me on the Hope Pre-Event podcast.
Thanks for having me.
Well, I'm super excited to talk a little bit more about von Willebrand's disease, something that you and your family have been very affected by and know a whole lot about. And so I wanted to give you an opportunity to kind of just introduce yourself, share with us where you're from and how you're affected by a bleeding disorder. That'd be great.
Well, I live with my family, my husband and 2 children in Wisconsin. I have von Willebrand disease type 1. My son, who is 10, has severe hemophilia and von Willebrand disease. And my daughter, we are going through the diagnosis process, which seems to be dragging on right now, and she is 7.
Wow. And tell us a little bit about living in Wisconsin. Obviously, we know it's cheesy up there, one of my favorite food groups. But besides that, tell me a little bit about your work background, because I think that's also played a benefit into this journey of getting diagnosed and getting treatment, right?
So I used to work, before I had children, I used to work in healthcare. I was a healthcare analyst, and I worked in couple different roles. I worked for an HMO for a few years in Madison, and I learned a lot there about how our healthcare system runs, and both the good and the bad. I moved on to work for the state as a contractor, working back with the HMOs. And then I also worked in pharmacy adjudication for government programs, like your Medicare Part D, working in that kind of hidden industry that goes between the pharmacy and you when you go fill your prescription and your health plan.
Right.
And I learned about the cost of drugs there, and how that process just plays out to get a drug approved and filled.
Yeah, which is amazing because at that time you were not diagnosed with a bleeding disorder and you didn't have children. So this was really preparing the way for you to have the right language and even be able to help sort of advocate for yourselves, right?
Yep. When my son was born, we knew something quickly was very wrong with him. And after he got diagnosed, about 5 months later, as I was talking with hematologists, they realized that I may have some issues that didn't align with hemophilia. So they did test me for von Willebrand disease, and I was diagnosed at that point. I've had lifelong issues with bleeding, very heavy periods. I always bruised really easily. As I was growing, kind of going through growth spurts, I would have a lot of issues with joints just being very sore and swollen and not understanding what was going on. And then once I was diagnosed, it all made sense.
Mm-hmm. Mm-hmm. And for you, you really had a lot of difficulty even going into having menstrual cycles and some of your challenges there. That was a huge indicator, which still, oddly enough, was not diagnosed, right, at the time.
Yep. So my family just told me this is how our family bleeds. This is how our family has periods, and you just have to get used to having heavier periods.
Mm,
In those teenage years when it's really important to have just have things feel normal, things weren't normal. I'd have a
mm,
period start at the beginning of class, and kind of from that generation where we weren't allowed to leave class during class. We had to use the bathroom during passing period, and I would not be allowed to leave. And then I would have to leave school because I would um,
mm,
bleed through underwear pants. If I was wearing a pad, sometimes I would bleed through that.
mm. I'm so sorry. Once you did get diagnosed, which I know kind of happened after your son's
Mhm.
diagnosis, but just once your diagnosis came about, was that something that was sort of validating, and did it help you feel like you were had a reason for why you had experienced all this before?
Very validating. It made me not feel so abnormal. I
Mhm,
felt like what I
mhm,
was going through was directly related to my health and not anything I was doing wrong, or
mm.
I just didn't. I didn't feel bad about my health anymore because I felt like there was
Yeah.
maybe something I was doing wrong, or
Mhm,
that I wasn't handling it well. Everyone has,
mhm,
all these women have periods every month. How does mine feel worse than theirs?
mhm.
Suddenly it made sense to me.
We talk to so many people that seems to be a common thread where people feel like they're not by not being heard, almost like they're shamed and feel like
Mhm.
something's wrong with them, and we constantly like, oh my gosh, like there's nothing wrong with you. It's not your fault. It's something that you just need to get treatment for. And unfortunately, the solution in some ways can be so simple, but in another way, getting to a diagnosis and even getting treatment can be a huge uphill battle. And I want to get to your son and your daughter and some of the challenges you're working on there, but just where you are currently in this time, you still have times where it's easy to get treatment and not easy to get treatment, right? Even with the diagnosis, it didn't mean immediately you got care right away. Is that right?
Yep. Even with the diagnosis, I went through a number of years where I would be diagnosed by a doctor, and then we moved, and a new doctor had
Mm.
said, "Oh, you don't actually have that. You don't have levels low enough." And then we had only moved for a short time for a job, and then when we moved to another location, the doctor said, "No, you definitely have this." And so we got treatment, and but the
Wow.
treatments, weren't immediately a factor. Over the years, we've kind of watched the treatment evolve.
Hmm.
It started with Stimate, and I had some reactions to Stimate, and then it would just be the tranexamic acid tablets.
Hmm.
But then through the years, I don't know if it was just different nurses, different doctors on call, but sometimes they would say I don't need treatment, I just need to rest, or and then I'd go in for something else, and a doctor would say definitely you need treatment, and I'd get treatment.
Wow.
One time bringing in my own Factor product, which when I finally got to carry Factor at home, still had trouble with self infusion. So I went into the ER, and the ER doctor accused me of stealing my son's product,
Oh my
um,
gosh.
and refused to help me get an IV in so that I could infuse.
Wow.
Um, but
I'm
that was
so
my I
sorry.
broke a toe for that one.
Oh,
And I needed Factor pretty quickly, and it was very
yeah.
painful. But I was unable to get Factor for that right away. Um,
Even with your own prescription,
yeah,
walking in the
yeah,
clinic with your medication, that's crazy.
I had to
Wow.
wait till Monday. It was over the weekend. I had to wait till Monday and drove up to the hemophilia center,
Mm,
and they're an hour away. Drove up there, and
mm,
they infused me.
wow. Let's talk a little bit about your son's diagnosis, because
Mhm.
when he was born, that was really the impetus of your whole family
Yep.
starting to investigate more. So tell me a little bit about that. How did you find out that he had a bleeding disorder?
So my son was a very, very large baby, nice 10-pound, 4-ounce, healthy child. But when they did a heel stick on him to check blood sugar levels, it never clotted. The entire
Mm,
time we were in there, It just bled and bled and bled. And on the third day of after he was born, the pediatrician finally came by and realized there was some issues. And they ran the PTT test because we weren't at a major hospital and said his blood's not clotting at all. So they discharged us on Friday and Halloween at that and said, you have an appointment on Monday at the Children's Hospital. If
Wow.
anything happens over the weekend, feel free to call for an ambulance,
Wow.
which was terrifying. But
I
then when we
bet.
got him in, they were able to immediately on that Monday get him in and diagnose him and give us more information.
Wow. And did that start the process of, and of course now his diagnosis is a little different than yours,
Mm-hmm.
or that what you've seen so far, but did that start you down this path of thinking about the rest of the family too, or was it just kind of like you were so focused on him at the time you didn't even think about anybody else?
For I think about the first 5 months, it was just thinking about him, making sure he
Mm-hmm.
was healthy because we had a lot of bleeding challenges with him in those first 5 months. We didn't seem to get, they call it the golden year with hemophilia. Sometimes a lot of the time you won't see bleeding issues till they start becoming mobile.
Mm-hmm. Mm-hmm.
And he had more issues. We had a lot of muscle bleeding with him.
Mm-hmm.
And so at that 5 month mark, I brought up to the hematologist that I was having some issues and still bleeding postpartum. And the OB had kept saying, it's normal, it's normal. And they said, no, it's not. And so they ran my blood work and came back with von Willebrand disease because my bleeding patterns that I described didn't tend to line up with hemophilia.
Interesting. One of the things that I find is fascinating as we continue on down this journey. I mean, a lot of times I think we do know so much in medicine, and it's kind of like, wow, there's so much that we do know. But it's sometimes I have to remind myself there's far more that we actually don't know
Mm-hmm.
in medicine than what we do know, and we're all learning, including the physicians, including the treatment centers, including all of us. We're all learning, and I do think that there's gonna, I hope, at least for a point in the future, that these things would be a lot easier to just sort of nail down. But if I'm not mistaken, you have a low factor 8 level as well as
Yep.
von Willebrand's diagnosis. So just because you have a low factor level in both cases, they still won't diagnose you with hemophilia like your son has, which is strange and frustrating, I'm sure.
Yeah, I'm still diagnosed as a hemophilia carrier. And then my primary diagnosis is von Willebrand disease, though, with hemophilia carrier. Like I still have that carrier on my chart, which,
Yeah. Yeah.
I get treatment, so it's
Frustrating.
not something I've really fought.
Mm-hmm.
But at the same time, I think that there's something to putting that down as having hemophilia as well. But
Yeah. Well, especially in an emergency situation, which you've had lots of experience with, where there's been moments where you had an injury or something else that happens and you need quick care. They a lot of times want to start the process over and start going back. Well, we're not sure. And that delays
yep,
treatment, right?
yep, I have a lot of treatment delays. Oftentimes when I go to the ER, as I wait for the on-call physician from the hemophilia center to call. Sometimes
Mm-hmm.
they listen to the on-call. Sometimes they
Mm-hmm.
don't. I have really good outcomes when they listen to that on-call physician in the ER, but
Mm-hmm.
poor outcomes when they choose to not listen, and that
Mm-hmm.
does happen.
Mm-hmm.
I've walked out without getting factor before.
Mm. And you're this is you have your journey, and then your son obviously has his
Yep.
journey. Have you seen like that your son gets a little quicker treatment than you do just because of his diagnosis, you
Yep.
think?
With his diagnosis, there's never a question. They immediately
Mm.
treat him. Then they do imaging. Then they do all the other diagnostics that they need on him. But there's never been a question.
Wow.
To the point where we had a previous treatment center and I made a phone call and I described bleeding symptoms. And I said, we've got a bleed here. I described the bleeding symptoms and they said, well, you should treat him immediately. And I said, well, no, that's me. Those are my symptoms. And they said, oh, well, drink a lot of water and just rest. Um, That was the breaking point for
Wow.
us to change treatment centers to one that would be a little bit more focused on women's care,
Yeah.
um, because that's important for me to be treated. Because as a caregiver for him, he needs me to be healthy too.
Right. 100%. And you're not done there, right? Because your daughter's had some
Hmm.
challenges as well that you're trying to work on now. Is that right?
Yep. So we had my daughter tested. She does not have the hemophilia gene, which is a huge blessing. But at the same time, she still has bleeding symptoms. So we've had her
Mm,
tested, but her von Willebrand levels hover between like 48 and 55.
mm,
So, but those tests are done while she's stressed out about a needle stick, and
mhm,
we
mhm,
can't get the doctor at our current center to get on board. So we
mhm.
are getting a second opinion on her, but it
Good.
seems to be a pretty long process because she's had 3 blood draws now
Mm,
that have all come back as inconclusive.
mm.
So she doesn't not have it, but she doesn't have it.
Wow. Yeah, we as you know that we have I have 4 kids and 2 of which are girls, and they've also had difficulty in getting diagnosed and treatment as well. And in contrast, in my story, I have hemophilia A, and have had treatment since I was pretty young. And even in my own home, we're seeing the dichotomy between where people prescribe for me versus where people prescribe for my girls is a totally different story. And I really believe that my hope is that there's a future where that won't be the case, and everyone will be considered individually, and that women won't be automatically discounted. But in a sense, you have to constantly really be very well versed in knowing how to really elevate and the issues at hand, and defend yourself. And I had a doctor recently tell me actually this about one of my girls. She said, it really shouldn't be this way. And she said, but unfortunately, you just have to self advocate. You have to speak up.
Mm-hmm.
And that's something that you've learned how to do really well, not only for your kids, but also for yourself. Do you think that you, as a parent, having also to try to advocate for yourself, do you think that that's, one has really helped the other to where you've been able to really, become a stronger advocate for yourself because you've had to advocate for your kids?
I think advocating for my son was really the teaching ground for me to advocate for
Mm,
myself, because I
mm,
learned how to talk to doctors about his hemophilia, especially ones who didn't
mhm,
know it. We've never really lived in a large city where we're seen at a hospital that sees a lot of bleeding disorders.
mhm,
I've had to advocate pretty heavily for him to get treatment first, imaging second.
mhm, mhm,
There's a lot that goes into advocating for these little guys, especially when they have a central line too. Um,
mhm,
Advocating for that central line and its safety as well.
mhm,
Um, Once I learned how to advocate properly for him, that's when I started standing up for myself and saying, you know what, you
mm,
guys taught me how to advocate for myself or for my son. I'm going to use it on myself.
mhm,
And I'm the caregiver for him, and so I need to be healthy. So I need to
mhm.
advocate for myself a lot better.
That's so good. It's amazing how those things kind of go hand in hand. I know even for me, like it's been a much, people used to ask me, is it harder to be a parent or is it harder to be a patient? And I would say it's much more difficult for me to advocate for myself than it is for
Mm-hmm.
me to advocate for my kids. I can be a pretty fierce advocate for my kids, but having to advocate for my daughters has actually helped me also advocate more so for myself too. So there's a beautiful synergy there that you learn from all of those experiences. They all count. And you're a living example of what it means to really be able to educate yourself, learn, and then and pivot, and also keep the pressure on working towards a healthier tomorrow. And is there anything that you're excited about with the future? I know treatments have changed to some degree, and there is even more future
Mm-hmm.
treatments coming out. How do you feel about your family living with bleeding disorders when you look at the future?
Um, We have noticed since heme labor has come out that the centers, the hemophilia centers, have been able to free up some time to
Mm-hmm.
really look at women and some of the more mild patients as well
Mm-hmm.
that have more mild numbers. We've noticed kind of treatment evolve
Mm-hmm.
from use just the nasal spray to use tranexamic acid. And now I have a factor prescription at home for when I have bleeds.
Mm-hmm.
And then there's been a focus on me learning how to self infuse and them being very supportive of that and having the time for that. So as the therapies evolve, even seeing them evolve for those more needy patients with the severe hemophilia, they're having fewer bleeding issues, which translates to more time for patients like me and my daughter to be able to be seen and have that focus. Um,
Yeah.
and then seeing new products come out, even for von Willebrand, seeing those products and how they're focusing on different levels and not just the most severe,
Mm-hmm.
um, has been really nice to see.
So do you feel inspired about the future when you think about those things coming?
Yeah, I can see my daughter having adequate treatment. I can see her not struggling through those teen years and having a monthly period and anemia to worry
Mm.
about.
Mm.
She's only 7 now, but that's going to come quickly. Time
Yeah.
with kids seems to really roll fast. But
You can blink.
yeah, so I do see that she's going to get better access to care than I had. Just
Yeah.
having the knowledge of bleeding disorders, I
Mhm.
see her having better access to care.
Yeah, and you've got to think that she's not going to suffer like you did as a teenager
Mhm.
and going through all those things and normalizing what's unnormal and I just think, that's really because of the championing that you've done by learning and growing and developing your own ability to navigate these healthcare challenges. I often say this about the broader community that the best thing about being diagnosed with a bleeding disorder is the community that comes along with it, and that happens first in the home. And the more that we support each other and grow, and the more that the treatments improve, the more that the providers even understand about these, like you said, they started with the most severe, and then it's kind of working its way out in terms of
Mhm.
even documentation and research and so on. I think there's a lot to be said for progress, and you've seen that happen obviously in your lifetime and in your kids' lifetime. And I know for me, I have a lot of hope in my heart about what the next 10 years looks like, because there's going to be even more progress. And there's a lot to be, I think sometimes as patient advocates, we can get so in the flow of being, it's always a battle in a sense. And so you're just
Yep.
always on guard, ready to, take somebody on. But I always say that there's a vast difference between someone who's an activist, where there's a sense of, kind of, just almost conflict oriented, versus someone who's an advocate, which is more education oriented. And I'm just inspired to know your story and hear your journey, because it really, you're a fierce advocate for yourself and for your kids, and I appreciate the journey that you've been on, because it really speaks to volumes about your character and who you are.
Thank you. Yeah.
It's amazing. I know too, like, you're a big advocate for self-learning, and this is one of the reasons
Mhm.
why we're getting ready to talk more about these types of needs with people living with von Willebrand's disease. As I mentioned in the opener, that there's a statistic that shows that there's probably far more people living with von Willebrand's than are even diagnosed with von Willebrand's. Is there any advice that you'd give anybody listening to this podcast today that may be wondering, man, I wonder if these symptoms are something that I've been dealing with and I haven't thought of yet? Is there any advice you'd give them?
Um, some of the symptoms I feel like are not life threatening immediately, like the day to day things, like the nosebleeds that you can get, the minor muscle bleeds. They hurt for a couple days, sometimes a couple weeks, and then you get over them, but you survive.
Hmm.
But
Hmm.
with proper treatment, with proper diagnosis, you can live a healthier life. You can not experience pain. You can have fewer interruptions to just living. And I
Hmm.
felt like once I got diagnosed and got proper treatment, I've been able to enjoy life a whole lot more.
Mhm,
I'm
mhm,
able to take some of those. risks where I know I might get injured, take a longer walk than I normally do, and I might end up with some, a little bit of muscle bleeding. I can treat that instead of just having to, oh, now I've got to stay off my feet for a few days. But that treatment
Mhm.
helps me live my life a little more fully, and less
Mhm.
fearfully of what could go wrong.
Mhm.
And then I'm not sitting out on the sidelines like I used to. I used to
Mhm.
literally sit on the sidelines a lot, and
Mhm.
not push myself as far as I could go.
Mhm. Yeah, it's so good. And I just think that people need to know that there are solutions. It is complex and it is important to be able to try to navigate those things carefully. But if you have those solutions, like you said, you can live a healthier lifestyle, you can live
Mhm.
a more meaningful lifestyle. And that's one of the reasons why we're doing these educational opportunities for people to come and learn as much as you can. If you're suspicious this may be something that you've been struggling with, or if this is something that you maybe heard about in your past family history, like you said, your parents told you, it's just the way that our family bleeds. Maybe it's not. We've seen a lot of women that have had hysterectomies even at a very early age when they first
Mhm.
started their menstrual cycles. They didn't really have to have that done because they needed was just a little bit of medication to be able to get through that. It's an amazing thing if you get the right information. It oftentimes can lead to better outcomes. So Steph, thank you so much for sharing your story with us today. And thank you for being the advocate that you are. There's so much good things that come from sharing our story, the outcomes and the benefits of solving these problems than it is to just look at the problems alone. So thanks so much for being here today with me on the podcast. And we look forward to talking with you again soon.
Thanks for having me.
All right. Well, thank you so much again to Steph for being here and for being a part of this podcast. It's been a great conversation. I hope you enjoyed it. I hope you got something out of it. I would love for you to join me and Steph at the Advancing Von Willebrand's Management Conference coming up very soon on Wednesday, July 16th for an all-day journey of breakout sessions with talking about more depth of treatment plans. What's available? What do you need to ask your doctor? How do you advocate for yourself? Insurance challenges, all of the things that determine how you live your best life, just like Steph said. It's so important that you get involved and you self-educate and that you can continue to learn and grow. And so thank you so much for tuning into this. You can check in the comments below for the link for the registration. You can also go to our website at hope-charities.org, learn more there as well. And if you have any questions, you can also email us at events@hope-charities.org. And we would love to answer any of your questions for you and help guide you along your health journey. We're going to have a lot of fun at this event. We love generosity, and we're going to be doing raffles and giveaways in every session. So it's going to be a blast. So come and enjoy it. Have a great time. Get connected to some other folks who are dealing with these same types of issues. And we look forward to seeing you there. Thanks so much for joining me today and listening in. And we hope to see you very soon in the next one.